Welcome back to Arizona Midday. Now let's talk about health. We're all keeping an eye on our individual health and well-being, but what does our community look like? Here to tell us how we learn more is Dr. Martin Celaya. Thank you so much for joining us.
Thank you, Vanessa. Thanks for having us.
Okay, so let me ask you this. What is the AZ-BRFSS survey? And first off, what does that mean?
Sure. So the Arizona BRFSS survey stands for the Arizona Behavior Risk Factor Surveillance System.
Ah, okay. Now break it down for us.
Sure. So this is one of our longest partnerships with the Centers for Disease Control and Prevention. It's one of our the bread and butter public health surveys. It's been going on for around 40 years now in Arizona.
Wow.
And you just want to remind the public that it's still here.
Okay.
And that we're out here collecting vital information that we need on the health status of our communities.
Oh, wow. For that long, that many
Correct.
years?
Yes,
Okay,
40
yes.
years.
So that means it's very important if it's lasted that long.
Yes, definitely. So just how you may go to your personal doctor to get a usual checkup, this is how public health does a checkup on our community. How we're doing in terms of health status, what's working, what's not so working, what can we focus on.
Okay. So who is contacted for the survey?
So adults in Arizona, all Arizona residents over the age of 18 are eligible to participate, and we do a random selection of participants in our state.
Okay, you did say it's random, but how do people's contact information get shared?
Absolutely. So we work through random digit dialing. So when we first contact individuals, adults, we don't know the person's name or information. It's literally just random digit dialing that we work in partnership with CDC to get those numbers.
Okay, so then that means someone may just get a phone call and they're going to ask these questions and they can participate?
Yes.
And just share all their information with you.
Exactly. So you'll get a caller who will identify themselves as working with the Arizona Department of Health Services, identifying themselves as part of the survey, and then we'll go in through the survey with people's permission, of course.
Okay, perfect. That's good to know because, you know, sometimes we get phone calls and we're not too sure if they're legit.
Correct.
So if they recognize themselves as that when they're calling and this is for an important survey, then you know that they can answer and share information.
Yeah, absolutely. And folks can always go to our website too if they wanted to confirm that it's a legitimate survey, and we understand that's a pretty vital concern that our communities have.
Yeah. So what information is collected? I know you touched on it a little bit earlier.
Absolutely. So anything related to health conditions, health status, access to a doctor, having health insurance, things of the sorts, but also the circumstances where people are living. What are the conditions? Is it safe? Is it a good neighborhood? Those things help us make some pretty good actions for public health.
Okay, so now you said this has been going on for 40 years, so it's important information that is collected, but what is done with that information?
Sure, so that information is then utilized by our various different programs. We also share that information with our local county health departments so that they can make good decisions, and with the CDC so that we can inform public health policy and programming.
Okay, so tell me again, how important is this? Because, you know, what if someone does get that phone call and they're like, they dismiss it, but instead, I mean, tell us why they should answer the phone call.
Right, so it's vital that people participate in this survey because this is how we get the pulse of Arizona's health. And so a lot of our public health programs, a lot of other decisions can also be based on the information that we gather. And so it's one of our most pivotal data sources, and we get it straight from our residents. Perfect,
okay, so people answer that phone call when you get that and then answer those questions as well. So if people want to learn more and not wait for the phone call, where do they go?
They can go to azhealth.gov/BRFSS.
Okay, and then how long is this going on till?
The survey happens January to December every single year for
January
the last
December.
40 years.
Okay, perfect. We have so much information that we can use now. Thank you so much for stopping by and sharing all of that valuable info.
Great. Well, thanks for having us.
And if you want to learn more, go ahead and visit that website there at the bottom of your screen.